So here we're going to show you a technique for L5-S1. This is the actual L5-S1 is one of the most injured areas of the lower back. L4, L5 is pretty commonly aggravated and injured too. So what we want to do, we want to create some space between this part of the lower back. So what I like to do is palpate the PSIS. That puts us about L4, L5 area. Then I'll create a little bit of decompression here on Kiki's sacrum, in fact, and I'll just pull the skin up this way. So I'm just trying to push down as I pull. So I'm pushing with my top hand and pulling with my bottom hand. And this is where you would hold. You can bias one side, so I'm going to work on the side closer to the camera. I'm pushing here, I'm going to hook this tissue, and I'm just trying to pull those joints apart. So I'm pushing and pulling, we just hold. You have to kind of take a deep breath in. The breathing increases the angulation of those joints. Flip to the other side, and I pull this way. Another great way to do this, depending on the size of you and the size of your clients, just to place an elbow on the angle of the sacrum here. This arm goes really close, so I'm going to get under this hip, and it's literally, I'm pushing this way. I'm trying to tease these tissues apart. And another good way to release this area or to create some movement is have your client do slow pelvic tilts. So tip your forward. So when she tips back, I really try and open up this way, my left arm, this arm here. So I'm trying to create motion. Good. I'll go here. How's that feel? Pulling this way. This is a great technique for those clients who are limited in hip extension. They have quite an exaggerated curve when they lie down, and or if they get lower back pain stiffness in this prone position. So to recap, PSIS, those two big nodules that you feel on the back of the hips, normally like associated with those little dimples you see on the hip. Place the hand in between, palm up, or palm down, sorry, fingers up, and I pull. So I'm trying to tease those apart. I can bias one side. So this hand is pulling down, push forward. Pulling down, pushing forwards. A great way if you're going to be here for a while, forearm, and just slowly tease this back and open up this way. Just trying to really distract those two joints.